All right, hello, my name is Carmen. I'm going to be doing the IV Med Push and the IV Piggyback skill today. I would follow all GPSP guidelines and I would perform my 3 checks and follow my 11 rights. First and foremost, I would check my MAR for Lasix via IV push for this one. I would knock, introduce myself. My name is Carmen. I'm going to be your nurse today. Can you verify your name and date of birth for me? Yes. Do you have any allergies that I need to be made note of? No? Okay. My first check would be checking with the MAR, and then the second check would be pulling the med, which I have right here. And then I'll go ahead and assess the site for any complications, and I will go ahead get my hub ready, clamping my IV to stop it, but also holding it here just to make sure. Removing the hub. I'd go ahead and start the 10 milliliters of saline, and I would scrub the hub. Make sure that this is unclamped as well before I start administering it. Then I would administer the full, I would push, aspirate, make sure there's blood returned. Then I'd push the whole entire saline very slowly. Once that's done, go ahead and get the medication. Doing my final check for my 3 checks before administering it, making sure it matches the MAR. Go ahead and scrub the hub. And I would administer the medication as prescribed. And once I administer the whole thing, finished, then I'll do my final syringe of saline. And I'd scrub the hub. And I would administer that at the exact same rate that I administered the medication, fully. And then all that's done. Then I would scrub the hub one more time. And then I'd get a new cap it, and then start back the IV fluid as prescribed. And then I would document immediately. After performing hand hygiene, I would report and record. And then I would come back to evaluate the patient's response and leave the room. Check the MAR, saw that I had an order for a piggyback. I'd knock. I would assess for any allergies that they may have, verify the 2 patient identifiers, complete any assessments that are needed before administering any medications, making sure that everything is compatible, including the medications, the dilutants, and the IV infusion rates. Then I perform hand hygiene. Go ahead and put on my gloves. And then I assess the site, making sure that there's no complications with it for infiltration or anything, making sure that this clasp is still closed for right now. And I follow my 11 rights and my 3 checks on my new medication that's supposed to be piggybacked. Go ahead and make sure that my clamp is closed on my secondary tubing. And put this on. Make sure my clamp is closed on my primary tubing. And then I check, do my final check for my piggyback. Making sure not to contaminate. And I would prime, make sure that this is to the halfway mark. And then take this off, making sure to not contaminate it at all. Prime it. Making sure only to do a little bit so we don't lose a lot of the medication, and I can recap it because it's not contaminated. I'll go ahead and hang this back up, making sure that everything's running correctly. I'll go ahead and get my site ready. Go ahead and take off my disinfectant cap, making sure to clamp this. I would scrub the hub. I'll go ahead and connect this. And this has not been contaminated, so it doesn't need to be clean. And put this back and make sure that I administer this at the rate that's ordered. Making sure that all my clamps are unclamped. As you can see that this is running and this is not, so everything's working fine. I would assess the IV site and my patient whenever it is being administered, and then I would report and record after taking off my gloves and performing hand hygiene. I will check periodically to make sure that the medication is going at the correct flow. And then I would come back once the medication needs to be discontinued. Assessing my client, my patient, and the IV site, making sure that there was no infiltration at any point. This is empty, but I'm closing the clamp. I'm closing all the clamps. I would go ahead and discontinue this. And I would get a new cap for this. And I'd go ahead and put this at the correct site, and I check to make sure that it is infusing at the correct rate that was ordered. And go ahead and unclamp everything. And I would discard of this medication that's already been given appropriately. And making sure that everything's going correctly, it's infused at the correct rate, and there's no complications in the IV site, and the patient is feeling okay. I would perform hand hygiene and document immediately, and then come back and evaluate my patient's response, making sure that everything is okay.